Hi, welcome to Massage Wise. I hope you came here with questions because I hope to have answers. So, today in the video, of which you're probably going, okay, get to the point, we're going to be talking about intake paper. And I'm going to be explaining to you, the potential client, how I, the massage therapist, glean information that's going to help me to make your session as effective as possible based on the information that we see on your intake form. However, before we get started, let's just be completely honest. Every YouTuber does this. So I'm going to tell you that the YouTube algorithm is not nice to everybody. So if you like the content, please like and subscribe to this channel and leave a comment, which I will do my very best to answer if I possibly can. I do enjoy having questions asked of me so that we can see how much I know and how much I don't know. That way, we all learn together. So, like, comment, subscribe, and if you really want to help me out, share. Share this with friends and family that they might too be ready to go into a professional massage setting and understand what's going on. Okay, so there's some things that are absolutely no-brainers, and there's some things that as a massage therapist I really don't care about. Okay, I don't care about your address. I don't care about, how you're paying for this. Most of the time, if you're going to a massage setting, most of the time it's to a facility that takes care of that for the massage therapist. If you're going to a massage therapist that's a private massage therapist, it's going to be more important. But for me, as the massage therapist, most facilities have us as employees instead of private contractors. So that's not very important. Your name, that's part of manners. We need to know your appropriate name. And that means your legal name. Because this paperwork is considered legal documentation. If in question, we have to be able to use this paperwork in court. So if you're one of those people that have one legal name and then you have a nickname or a other name that we're just going to say, because there's too many instances of an other name, um, you need to put down your legal name because this is paperwork that's construed as legal paperwork. This proves you, in fact, did have a massage. Now, if you put your nickname or your other name on there and you're trying to prove that you had a massage, your legal name's not there, so it, in fact, doesn't prove you had a massage if there was an actual incident that occurred. So your legal name, first, middle, last, stuff like that. We need to know your age group because certain populations of the general population are put into different age groups for different risks and for different things that we're supposed to pay attention to. We do, in many instances, see massage being given to like 8-year-olds to teenagers. And so the younger the client, the more we need to be aware of growth plates, of muscular development, of muscular strength. You're not going to treat an 8-year-old the way you would do, let's say, a triathlete 26-year-old. So there's that. And male and female, and I know a lot of people might disagree with me on this, but male and female is very important because male bodies have that testosterone dominance. And testosterone is very important with building muscle. Women don't have a lot of testosterone, so you don't really see a lot of roided up females walking around like Arnold Schwarzenegger when he was Mr. Universe. So you're going to be dealing with male muscles that are potentially a lot harder, a lot stiffer, a lot more rigid when they have those muscular issues versus a female where you're probably not going to try and Iron Man her shoulder into a rotation. I mean, outside of frozen shoulder, you don't want to have to be fighting their body to get them to work into a more relaxed state. So, understanding if the client has an estrogen dominance or a testosterone dominance is very important. Next is we need to know what you do for a job or what you do that is the potential almost totality of what you do during the week. This tells us about your repeat actions, like how long you're sitting, how long you're in a vehicle, like if you potentially sit in a vehicle a certain way, if you drive a stick shift, if you drive an automatic. Um, If you're a waiter, if you do computer work, if you're a truck driver, if you stock shelves. These things help us because it tells us what the repeat actions are that your body does that could, and more often than not, contributes to your muscular issues. And the only thing that's potentially more important than that is your health. Have you been going to the gym? Have you been eating a healthy diet? Um, have you had a heart attack? Have you had a stroke? Did you have a baby? Are you diabetic? Do you have high blood pressure? Do you have scoliosis, lordosis, kyphosis? We need to know what the issue is because with a lot of those conditions, you have to approach it at a more smarter, not harder perspective. If you have uh, diabetes or if you have blood pressure, we need to know if that blood pressure has an issue skyrocketing up or bottoming out for the simple fact that massage therapy has been proven scientifically to lower your blood pressure and lower your blood sugar. So if you have a problem with your blood pressure or blood sugar where they bottom out, we need to have steps put into place where if you're feeling this happening to your body, in the case with diabetics, we need to have a sugar on hand that you can ingest so you don't go into a diabetic coma on my table. Not fun for you, not fun for me, not fun for the ambulance that we'll have to call if we don't have any preparation and you go into a diabetic coma on my table. Or like need to make sure you have your meds on you and or take it beforehand so that we don't have that issue arise and you can relax and you can have that massage therapy that assists you in that arena. But like I said, we have to have that pre-knowledge. If you have mental disorders such as disassociation, where it's kind of like your brain goes one place and your body's in another and you stop responding, we need to be made aware of that and we need to have a game plan in place so that once the massage therapist recognizes that you're in a dissociated state, we have A, B, and C that must be done. If you have been in a car accident for the like at least 72 hours before, most of us will say, hey, if it's outside of the 72-hour window and you're in a certain you're in a safer age group, we're okay. But like if you're older and you're in the age group that's more prone to fractures, we would like you to potentially, no, not potentially, just get a doctor's note, okay? We don't want to cause harm. We're healers. We don't do this because we want to bust people up. We do this because we want to help people. And helping people does not always mean that you hurt them. There are those instances where you're popping a joint in place, which is not our wheelhouse. But there are some things in the medical field where it hurts while you're doing it, but it helps in the long run. But massage is not one of those things, unless you're dealing with tonic muscles or petrified muscles. So those kind of things are important. We need to know if you've been in a car accident. We need to know if like you've been in an extra long car trip and so you have been in a prolonged state of not a lot of motion. If you're a weight trainer, if you've been injured, these things we need to know so that we can appropriately apply all those skills and tools that we've been taught to be able to give you a safe massage that is effective. Now, some massage therapy centers will actually have the soap notes. So these are notes from the therapist that worked before me. So if you've gone to a particular clinic or retreat and somebody else worked on you before me, the soap notes are for us therapists to basically talk to each other. Because in some places, the turnover rate in therapists is really high. Some places that are really ridiculous, some places that, that this person left because of myriad of reasons. Maybe she had a baby, maybe they had to move, but these tell us about the sessions beforehand. And so between what we need to glean from you and what we get from fellow therapists, we build this picture of what we need to do for this session to make it therapeutic, to make it effective, to make sure that we don't cause harm, and to, at times, because of smaller, minute details, such as with men or some women, Uh, we have the issue of body hair, where you have a question of which medium do you use? Do you use a lotion? Do you use an oil? Do you use a gel? Small stuff like that. Um, these kinds of things help us out when you're filling out the paperwork. And so, if we understand what you're physically doing most of your week, we understand your health history, we know what your job is, so we can figure out what motions are contributing to this. Those things are very important in massage therapy. That helps us build a picture of you as a client and what you need versus what you might not know to ask or you might not know to tell us. And so that's just a little bit on the soap notes and a lot on what's very important with that paperwork. So please, when you go to spas, retreats, clinics, wherever, make sure you fill out that paperwork effectively, people, and have a safe time enjoying massage therapy. If you enjoyed this episode, and if you like this episode, please check out my other episodes at MassageWise. And if you have a comment, please leave a comment. I will get back to it. Have a nice day.